Okay, this is Miss Mindshine. I'm doing a voiceover for this chapter 13. So this is part 1. We'll do part of the chapter and then we'll move on to the next section. Hopefully this time it will work. So before you begin, if you go to page 175 in your textbook, you can find all of the vocabulary for this chapter. And if you will remember, I told you vocabulary is very important for this chapter to be able to answer the questions on the test. You can go to your workbook and complete numbers 1 through 28 and numbers 83 through 96. There's also a crossword to help you review vocabulary, and you have been given a link for Quizlet for vocabulary for this chapter. Skills that are related to chapter 13. For your testable skills, you have your aseptic hand washing. And then you also have your donning and doffing personal protective equipment for contact precautions. You also have video skills available for this chapter. One is performing hand hygiene. One is hand hygiene using alcohol-based rub. And what you'll see is hand hygiene is used instead of hand washing because the use of alcohol-based rub has become a very important part of our practice. Also using personal protective equipment, and that shows you more than just the gown and gloves. It shows you donning of gown, gloves, mask, goggles, and also the order to put them on and take them off, and that's something that you need to know. So we're going to talk about infection prevention. That is the goal of this whole chapter. We need to understand that infection is a major safety concern and it's a health hazard. So infection control falls under safety. Remember that all of your critical steps for your skills relate to safety, and infection control is included in that. We need to also keep in mind that our population of residents, the older and disabled people, are higher risk for infection. So we have practices and procedures that we use to prevent the spread of infection, and we call those practices and procedures infection control. Infection control is not just for the resident, it's for the visitors and the staff as well. So let's talk about microorganisms. Microorganisms and microbes, the words are interchangeable. So micro means very small. Organism could refer to a plant or an animal. So a microorganism or a microbe is a small living organism that has plant or animal-like characteristics. We can only see a microorganism or a microbe with a microscope. They're everywhere. They're in the air, they're on your skin, they're in the soil. Animals can carry it, people can carry it. So microbes are everywhere. But not every microbe is dangerous or harmful. So we have two different categories. We have pathogens, and these are harmful and can cause infections. Then we have non-pathogens, which are microbes that do not usually cause an infection. And just ding, 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 you need to know, once again, your vocabulary for this unit. So let's break down these microbes into different types or categories. We have bacteria. Bacteria have plant-like characteristics. They multiply rapidly. Sometimes they're called germs. Examples of bacteria are streptococcus, and that's what causes strep throat. You know that bacteria are killed by antibiotics. Some bacteria, we take oral antibiotics. Sometimes we use topical antibiotics, or sometimes IV antibiotics or injection of antibiotics. So anyways, bacteria, they're one-celled organisms. They multiply rapidly. They are fought by antibiotics. We have fungi, and these are plant-like organisms. They live in or on other plants or animals. Examples for the human body are a yeast infection or athlete's foot. Usually fungi are kept in check by our good bacteria, but sometimes we do still have infections with them. They are treated with antifungals, and antifungals are sometimes a cream or a topical. They can also be oral or IV, just like antibiotics, but antifungals. Protozoa, these are one-celled animals. They're organisms with animal-like characteristics. Sometimes they have flagella and they can swim in the water. They can infect the blood, brain, intestines, and other body areas. They're not as common in the United States. Many times they are spread in contaminated water. So if you're a history buff, you heard of dysentery in the war, and that was caused by infected water, and it was a protozoan infection. Rickettsia. Rickettsia are a bacterium. They are found in fleas, lice, ticks, and other insects. So rickettsia infects a human through a bite. For example, a tick bite could cause Rocky Mountain spotted fever, and that would be through the rickettsia that's injected into the body with the tick bite. Viruses grow inside of living cells. So a virus is the smallest of the microorganism pathogens, and they have to have a host cell in order to regenerate. So they actually kind of hijack the host cell and start replicating themselves, and then they burst that cell and go and infect other cells nearby. So common viruses could be one that you would get over easily, like a common cold or the flu. And then other viruses you don't get over, such as HIV or hepatitis. And those are examples. Herpes. So things that microbes require. Microbes need a reservoir, and another name for the reservoir is a host. And this is a place where they live and grow, and it supplies them with their needs. So their needs are water and nourishment, some type of organic material. Most of them require oxygen, although there are anaerobic organisms that thrive in places with low oxygen. They usually require a dark environment where it's warm, especially body temperature. So what you see happen when you have an infection is your body kind of battles that with a fever, because that is not an ideal temperature for an organism to grow. Things that destroy microbes: heat and light. So let's say, in review, the reservoir is the environment in which a microbe lives and grows. Examples of reservoirs are people, plants, animals, the soil, food, and water. And these could also be considered carriers of the microbe. So a carrier is a person who is infected or can cause other people to be infected. Once again, look at your vocabulary. Another type of microbes that you need to know are normal flora, and these are microbes that occur normally in an area. For example, I believe we've already talked about how Escherichia coli grows in your gut, so that would be normal flora. You have normal flora throughout your body. You have good bacteria that keep other infections from growing out of control. We need to talk about multi-drug resistant organisms. These are microbes that have in the past been treated with antibiotics, but they have mutated to resist the effects of antibiotics that are typically used to treat them. So common causes for MDROs are the doctor prescribing antibiotics when they're not really needed. Remember, like viruses and funguses, we don't treat those with antibiotics. So if those antibiotics are consistently ordered when they're not needed, then that can lead to a multi-drug resistant organism. Another way is when people do not take their antibiotics as directed. For example, if you're supposed to take your antibiotic 3 times a day for 10 days, and after about 4 days you're feeling better, so you decide not to take it, that's not following the directions, and that can also contribute to multi-drug resistant organisms. 2 of the most common types of MDROs are MRSA, methicillin-resistant Staphylococcus aureus, commonly referred to as a staph infection, and then vancomycin-resistant Enterococcus, or VRE. These are very common types of multi-drug resistant organisms that you will hear about. Another common infection is Clostridium difficile, and this is actually a toxin that grows in your gut and is usually kept in check by your good bacteria, but people who have been on antibiotics are at risk of having an overgrowth because antibiotics kill your good bacteria along with the bad bacteria. So in review for this section, you can go to your book and read page 176. You also should complete review questions 1 through 3 and 10. Those are at the end of your chapter. And then workbook questions 29 through 35. So let's go ahead and define infection. Once again, vocabulary. Shall I say that 47 times? So your book defines infection as a disease state resulting from the invasion and growth of microbes in the body. So let's discuss two different types. A local infection is in any body part. For example, if I cut my finger and it became inflamed and infected, that would be a localized infection. If I didn't get that infection treated and then it goes throughout my body, that would be systemic. Another example would be a bladder infection. That would be local, but when that's not treated and then it becomes what we call septic, that would be a systemic infection. Other examples of systemic infection would be the chicken pox. So you have in your book a box that describes symptoms. So a systemic infection would have more than one of those symptoms. The thing that we need to keep in mind for older people is that an infection can become life-threatening before the person even has obvious signs and symptoms. So during an infection where we would normally have redness or swelling or a fever, the older person may not show those signs and symptoms. They may not complain of pain or fever or anything at all. So sometimes the very first symptom of infection in an older person is confusion and delirium. And I will make a note that delirium is a state of confusion that is acute onset and usually will go away once the cause is treated. So that's different from dementia. So this person has a sudden onset of confusion that's not normal for them. So you should be very aware of subtle changes in your residents and report anything out of the ordinary to the nurse at once. So in review of this section, you can read pages 176 through 177, review box 13-1, review question number 11 at the end of the chapter, and workbook question number 36. Chain of infection. So if we think of the chain as a process, you need all of these links in order to have an actual infection that keeps on going, okay? So first of all, in order to have an infection, we have to have a source. So names for the source may be causative agent or pathogen, but you cannot have an infection without some type of pathogen, something to cause the infection. So not only do you have to have the pathogen, but you also have to have what we call a reservoir. And this is a place where it can grow and multiply. And remember, that can be a person, it can be contaminated water, it can be food, it can be a dog, wherever. But the reservoir is where this pathogen is growing and multiplying. In addition to a pathogen and a reservoir, we need a way out of the reservoir. And we call that a portal of exit. So if we consider the human body, many times the portal of exit is any opening. So if you consider the flu and we cough, that's coming out of the mouth or the nose, that's the opening. Also cuts, that's the way pathogens get out, so bleeding. Vaginal secretions or semen, stool, those are ways for infection to get out of the body. So basically, we have a pathogen, we have a place for it to live and grow, and we have a way out of that reservoir, and that is the portal of exit. So after leaving the reservoir through the portal of exit, it has to have a way to get to another host. So we may call that transporting, or we may call it transmission. So this is a way that it's transmitted to another host. And we focus on breaking this chain many times because we figure out how is this pathogen transmitted and what can we do to keep it from going to somebody else. So things like washing your hands carefully, or things like covering your cough when you sneeze, those are all controlling the mode of transmission or the method of transmission. So sometimes that could be through the air, that's how it's transmitted. Sometimes it could be direct contact or indirect contact. So those are ways that it can be transmitted. So after it's transmitted, then it needs a way to get back into another host. And so the portal of entry is into another host. And the portal of entry for the human is very similar. I mean, it's all of the ways that the pathogen can get out of the body, the portal of exit, those are the same way that a pathogen can get back into the body. So breathing in, or eating through the mouth, or touching the eye, or cuts in the skin, or sexual contact. Those are ways that the pathogen enters the body. And those are some examples. So anyways, we have to have a way back into another body. And the last chain is a susceptible host. So this is going to be another reservoir where this pathogen is growing and multiplying. But the word susceptible is very important here, because it indicates whether that person is at risk for infection or likely to become infected. Because you can be you can be exposed to a pathogen and not necessarily get ill. So that's just what susceptible means. For example, if I was exposed to the flu, but I've had the flu vaccine, then I am less susceptible than somebody who has not had the flu vaccine. There are lots of different ways that you can reduce your risk of infection. Things like sleeping enough, eating a good diet so your immune system is healthy, reducing your stress, and we'll talk about those on another slide. So in review, you can read on page 177 to 178. You can please review figures 13.1 and 13.2 and answer review question 12 at the end of the chapter, and workbook questions 37 through 308 and 103 through 115. Like we said, there's a lot of information that can relate to resisting infection, your ability to resist infection. Age, the very, very young and the very, very old are more at risk for infection. Your nutritional status, the foods you eat, whether you're eating a healthy diet and a balanced diet, which will help support your immune system. Your ability to cope with stress, your stress level, your fatigue, and that means tiredness. So getting enough sleep, exercising, and things like that. Your overall health. So there are some diseases that put you at higher risk for infection. Your health status, indicates whether you will resist infection or not. There are medications that also will put you at higher risk for an infection. And we're not talking about just illicit drugs. We're talking about maybe you're on an immunotherapy drug, and that's going to actually suppress your immune system. So lots of different medications that can affect your immune system as well. And then disease and injury. So if you already have a pre-existing disease, then you're at a higher risk for another infection, and then injuries. When your body is battling an injury, you're at risk for an infection as well. So page 178 for reading, review question 13 at the end of chapter, and workbook number 39 for this information. Okay, next slide. We're talking about healthcare associated infections, and this can be abbreviated HAI. So a healthcare associated infection used to be called a nosocomial, and you'll see that spelling in a couple of slides if you don't know how to spell that. But it used to be called nosocomial, now it's commonly called healthcare associated. And just like the name implies, this is an infection that actually comes about while the person is in a healthcare agency like a hospital or a nursing home. So there are a couple of common causes for healthcare associated infections. One is normal flora. So if you will consider that E. coli lives in your gut, and that is where it normally lives. And you also have good bacteria that are kind of keeping it in check. That's their job in your gut. But then consider wiping some stool from the back to the front, and now that E. coli enters the urethra and goes up into the bladder. Well, that's not a normal place for E. coli. So at that point, that normal flora has actually caused an infection. Another thing that happens with normal flora is our good bacteria get killed off by antibiotics, and so the normal flora isn't there to protect us from infections. The other way is just transmission from one person from a source to the person. So an example would be if I had a Mr. Tommy and he was my patient and he's on contact precautions for MRSA in his foot. Let's say he has a wound and I didn't use the proper personal protective equipment and did not wash my hands well and went and took care of Miss Carrie, and Miss Carrie ended up with MRSA. That would be an example of a healthcare associated infection by being transmitted from a person other than the person infected. So that is a very, very bad thing to do. So you got to really do all your protective strategies, okay? Okay, ways that we prevent HAIs. Medical asepsis, including hand hygiene, surgical asepsis, standard precautions, transmission-based precautions, isolation precautions, and the bloodborne pathogen standard. And these will be talked about more individually on future slides. So let's start with asepsis. If we consider asepsis as a large umbrella, we need to know the definition is asepsis is being free of disease-producing microbes, specifically disease-producing. There are two categories that fall under that broad category of asepsis. One is called medical asepsis, and this is also known as clean technique, and this is your common day-to-day interactions with your residents. The other is surgical asepsis, and this is also known as sterile technique, and this is where you use in surgery or invasive procedures, surgical asepsis. So medical asepsis is the practices used to remove or destroy pathogens. So with medical asepsis, the number of pathogens is reduced. Notice that it doesn't say there are no pathogens. It says the number of pathogens is reduced. A medical asepsis also is used to prevent pathogens from spreading from one person or place to another person or place. For example, we do housekeeping. We have certain procedures for our housekeeping. We have certain personal protective equipment. We have certain ways to wash our hands. Those are all medical asepsis. Now, sterilization. In contrast, we see the ION. When we see sterilization, that's the process. So when we sterilize, we destroy all microbes. Sterilization is the process of destroying all microbes, and that includes spores. Contamination is the process of becoming clean. So once again, these are vocabulary words. Aseptic practices. These are common sense and they sound so simple, but to prevent the spread of microbes, you need to wash your hands at these times: after urinating or having a bowel movement, after changing tampons or sanitary pads, after contact with your own or another person's blood, body fluids, secretions or excretions, after coughing, sneezing, or blowing your nose, before and after preparing or eating food. So remember, a very simple concept, but very, very important as well. Don't take it for granted. Other things that you need to do to prevent the spread of microbes is to provide each person with their own linens and personal care items. So if you take linens into Mr. Tommy's room, you're not going to take what you don't use into Miss Sammy's room, because once you take that into the person's room, that's considered contaminated. It goes into the dirty linen. Okay. Other personal care items such as toothbrushes, razors, personal care items like that. You're also going to cover your nose and mouth while coughing, sneezing, or blowing your nose. So that's cough and dab. Your hygiene is very important also, along with your handling of vegetables and meats and cooking utensils, okay? You need to highlight star ding 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 under hand hygiene. When you see this sentence that says hand hygiene is the easiest and most important way to prevent the spread of infection. So hand hygiene is the easiest and most important way to prevent the spread of infection. You need to know that, okay? And if you'll notice, it says hand hygiene, and that means it's not specifically hand washing, because we take into account that many times we use alcohol-based rubs now instead of strictly hand washing. Although there are times when you wash your hands, as we spoke of previously. So in review, you can read this information on pages 178 through 179 and page 183. The word we were looking at earlier, healthcare associated infections, is also called nosocomial infections. You need to go to page 179 and review common aseptic practices for residents with dementia. You also need to review box 13-3 on page 183 and 184. Your assignment is workbook numbers 40 through 44, and that's multiple choice, and then you have matching 97 through 102. Optional learning number 127 is also available for you. Okay, we're looking at supplies and equipment. One thing to keep in mind that we have increased the amount of disposable equipment that we use in healthcare, and it's for the purpose of infection control. So disposable or single-use items, they're thrown away after use. Multi-use items are items that we use over and over multiple times. So anything that is multi-use is considered non-disposable. Those items are cleaned, disinfected, and then when applicable, they are sterilized. So sterilized can use autoclave or steam or sometimes chemicals or gases, okay? So for cleaning strictly, we're going to reduce the number of microbes present and remove organic material. So anything that comes from the body is organic material, or food items, things like that. So on page 181, you can read that information. Also review question number 17 at the end of the chapter, and workbook questions 45 through 48 for this information on equipment. So we talked about cleaning equipment. We're going to look now at disinfection. So we need to know the definition. Disinfection is the process of destroying pathogens. So a common disinfectant is called a germicide. So germicides are disinfectants, so they are for destroying pathogens. They can be applied to the skin, tissue, and non-living objects depending on their directions. Also, there are chemical disinfectants such as cleaners and things like that. So we use that to clean surfaces and reusable items. And then we have the process of sterilization, which destroys all non-pathogens and pathogens, so all microbes, including spores. And we do need to talk about spores. Spores are formed by some microorganisms, and spores, they're not destroyed the normal way. Like a lot of times we can use alcohol-based rubs to wash our hands, but if you have somebody on transmission-based precautions for spores, that doesn't work. We have to use appropriate hand washing techniques for that. An example is the Clostridium difficile that we spoke of earlier. So anyways, hand hygiene, cleaning, disinfection, and sterilization are all important aseptic measures. So remember what the definition of asepsis is. Okay, so for this information, you're going to go to book and read at least page 182. Review safety and comfort, disinfection on page 182. Review figure 13-9 on page 183, and then answer at the end of the book, at the end of the chapter, numbers 4, 5, 15, and 16. And this is going to conclude this section of the voiceover for this PowerPoint. Couple of things to look at: hand hygiene, promoting comfort on page 179, and then boxes 13-2, 13-3, 13-4, 13-5, 13-6, 13-7, and 13-8. And we'll finish up this chapter on the next PowerPoint slides.